Lesson 6: Nurturing Bonds, Creating Meaningful Visits, and the Daily Routine in the NICU. As a parent, being present and involved in your baby's care can provide a sense of comfort and support during this challenging time. By participating in your baby's care, such as helping with diaper changes, feeding, and providing skin to skin contact, you can bond with your baby and promote their overall well being. This lesson will provide you with guidance on how to care for your baby in the NICU. We will cover important topics such as visiting your baby, the daily routine in the NICU, how to participate in your baby's care, dressing your baby, holding positions, comforting your baby, and celebrating their milestones in the NICU. The most important question that parents face when their baby is in the NICU is when they can visit. Each NICU has their own set of visiting rules, but generally they follow the same principles. NICUs are typically open 24/7 for parents, but they may have limits on the number of visitors allowed in the room at one time. Some NICUs may also have a restriction on the total number of visitors. These rules are in place to minimize the amount of germs that your baby is exposed to. The nursing staff will go over the visiting policy at the time of admission, but don't be afraid to ask if you need a reminder. The staff will be happy to explain the rules to you as they understand that this is a stressful time for parents. It's important to keep in mind that visiting policies may become stricter during flu season or during outbreaks of illnesses. Although the stricter restrictions can be difficult, they are put in place to keep your baby safe and healthy. Daily routine. In the NICU, the majority of babies are fed every 3 hours. These feeding times are important times for care and monitoring your baby's health. At each feeding time, a nurse will perform a thorough assessment of your baby, including checking their temperature, blood pressure, and changing their diaper. When it's time for your baby's assessment, the nurse will warm up their milk to the proper temperature for feeding. The nurse will then perform a head to toe assessment and position your baby in a new, developmentally appropriate position that promotes their comfort and prevents skin breakdown or flat spots on their head. Once your baby is comfortably positioned, the nurse will connect them to their feeding. The standard feeding times are usually 8, 11, 2, and 5 a.m. and p.m., but another variation of feeding times are 9, 12, 3, 6 a.m. and p.m. These times are referred to as touch times as they are also the opportunity for nurses to perform any necessary lab work or give your baby a bath. If you want to be present during their touch time, it's a good idea to let your nurse know ahead of time and plan to arrive 30 to 45 minutes before their feeding time. This way, you can participate in your baby's care and also hold your baby during their feeding if you wish. When visiting your baby in the NICU, it's essential to follow strict hygiene protocols to minimize the risk of infection. One of the first things that is expected for every parent or visitor is to wash their hands thoroughly before entering the NICU. The nurses in the NICU may ask you to use a specific type of soap or a scrub brush to wash your hands. This is to ensure that all the dirt and bacteria are thoroughly removed from your hands, reducing the chances of spreading germs to your baby. It is important to wipe down your phone with alcohol wipes before entering the NICU. Phones can be carriers of bacteria and viruses, and it is essential to take the necessary steps to reduce the amount of germs that are introduced into your baby's environment. Whether your baby is a micropreemie or a full-term baby, their immune systems are still developing and are fragile. It's crucial to do everything possible to protect them from harmful bacteria as it can make them sick. Being discharged from the hospital before your baby or having your baby transferred to a different hospital for specialized care can be challenging for parents. However, there are ways that parents can remain informed and connected to their baby's condition. One of the most effective ways is to regularly call the NICU for updates. Nurses in the NICU perform assessments and feedings every 3 hours, so parents can call after their baby's feeding time to receive the latest information. This can provide some peace of mind and allow parents to feel more involved in their baby's care. Many mothers who are recovering in their postpartum room choose to call the NICU during their pumping routine. This helps them stay connected to their baby and provides them a sense of comfort during a difficult time. Even though it may be difficult, it's important for parents to take care of themselves and rest when needed. The NICU staff is equipped to care for your baby, and they'll be happy to keep you informed with any changes or concerns. As a parent with a baby in the NICU, it's important to understand one of the most crucial parts of the day is when your baby's doctor comes to visit them. The doctor typically visits in the morning, but there is no set time, so it's important to be flexible. They will see the most critical babies first and then move to the more stable ones. If you can't be there during the visit, don't worry. The neonatologist will call you at least once a day with an update on your baby's status. If there are any concerning issues, they will let you know right away. To make the most of these updates, consider writing down questions throughout the day or night when you're not with your baby, so you can ask the nurse or the doctor when you speak to them. Stay positive and keep your strength. Your baby is in good hands. Ways to participate in your baby's care. One way to participate in your baby's care is to assist the nurse in taking your baby's temperature. While it may appear to be a small task, it is a crucial aspect to your baby's care. Temperature monitoring is especially important in the NICU to ensure that your baby is comfortable, maintaining the right temperature for feeding, and is not at risk for developing an infection. It is normal for babies to squirm or cry during temperature taking, and this applies whether they are 22 weeks or 2 years old. But as parents, you can provide comfort and reassurance to your baby during this process. Your presence and gentle touch can soothe your baby, making the process less distressing for both of you. Another way to participate in your baby's care and build a stronger connection is by changing their diaper. Although it may be daunting at first, it can be an excellent opportunity for you to engage with your baby and gain the confidence needed to care for them when you take them home. Changing a diaper can be an intimidating experience, especially if it's your first time handling a delicate baby. However, you don't have to worry because your nurse is there to support you every step of the way. They will provide you with necessary guidance and demonstrate the proper technique for changing your baby's diaper. Remember, if you have any questions or concerns, don't hesitate to ask your baby's nurse. They are readily available to assist you and ensure you both and your baby feel comfortable. While changing your baby's diaper, you and your partner can take the opportunity to talk to them, sing a lullaby, or simply stroke their hand, which can help establish a bond between you and your baby. It's also a chance to observe and get to know your baby better. You can check for any changes in their skin, note their feeding cues, and observe their behavior. Dressing your baby in the NICU. As your baby develops in the womb, they are exposed to their mother's scent and become familiar with it. After birth, using baby blankets, scent patches, or other clothing items with the mother's scent can provide comfort and a sense of security for your baby. If your baby is in a stable condition and they are maintaining their temperature well, they may be able to wear a onesie or other clothing from home. This can make them feel more comfortable and secure in the NICU environment. If clothing is not an option, a blanket can be used to cover the baby's mattress or swaddle them. Placing a scent patch that the mother has worn by the baby can also provide them with a comforting scent they are familiar with. It's essential to ensure that any clothes or blankets that you bring into the NICU are clean and washed. It's also important to follow any guidelines or restrictions set by the medical team regarding the items that are allowed into the unit. Bringing your baby's own clothes and blankets can be a small but meaningful way to create a bond with your baby and provide them with a sense of comfort during their NICU stay. Holding your baby in the NICU. As a parent with a baby in the NICU, visiting your baby is a crucial moment that can be both overwhelming and rewarding. Holding your baby may be one of the first things you want to do, but it can be intimidating with all the wires and tubes attached to your baby. However, nurses can assist you with holding your baby if they are stable, which is an excellent way to connect with your baby and promote breast milk production. Skin to skin contact is one of the best ways to connect with your baby and promote breast milk production. Holding your baby against your skin allows you to bond with them and make them feel safe and secure. The warmth of your skin against your baby's can be comforting and calming for them, and it can help regulate their body temperature, heart rate, and breathing. Your baby's sense of smell is also heightened when they're born, and the scent of your skin will be familiar to them from their time in the womb. Skin to skin contact is also beneficial for breastfeeding. It promotes the production of the hormone oxytocin, which is essential for milk letdown and bonding between mother and baby. During skin to skin contact, you can talk to your baby, sing to them, simply enjoy the closeness and the silence. It's an excellent time to observe your baby, take note of their breathing, and marvel the miracle of new life. Another way to hold your baby in the NICU is a swaddle hold. Holding your baby swaddled in a blanket is an excellent way to hold them and create a connection, particularly when you're unable to hold them skin to skin due to them being too ill. Although it may not be the same as skin to skin contact, your baby will still feel comforted by the warmth and scent and the sound of your voice. Swaddling can be an effective technique to help your baby feel secure and settled. Babies enjoy being contained and swaddled in a blanket as it reminds them of being in the womb. Swaddling can also prevent them from feeling overstimulated by their surroundings, which can be very important in the NICU, where there may be a lot of noise and bright lights. While holding your baby swaddled in a blanket, you can talk to them, sing a lullaby, or read a book. These small interactions can establish a bond with your baby and provide a sense of calm for both of you. Lateral hold. If your baby is too unstable to hold skin to skin or swaddled, there's another way you can hold your baby called the lateral hold. During lateral hold, you cradle your baby in a laying position in the air while the nurse changes the linen on their bed. Though it may be a brief moment, the lateral hold can be a special time to connect with your baby. You get to hold them in your hands and provide comfort while they are being tended to by the medical staff. This position can also allow you to observe your baby's breathing and movements, which can be reassuring in a time of uncertainty. Containment hold. A containment hold is a simple yet effective way to provide touch and reassurance to your baby. To perform a containment hold, you place your hands firmly around the top of your baby's head with your fingers spread out slightly. This creates a supportive and secure cradle for your baby's head. With your other hand, you can cradle your baby's feet or bottom, providing additional support and stability. You can also place your hand firmly on your baby's tummy or back, which can help soothe and calm them. This physical contact can be provided at any time and is particularly beneficial during medical procedures or any other stressful situations when they may be feeling scared or anxious. By offering reassuring touch and scent, you are communicating with your baby that you are present for them and are deeply concerned with their well being. As a parent, you want to do everything you can do to help your baby feel safe and comfortable, especially during times of stress and discomfort. One such instance may be when your baby is undergoing a medical procedure, such as having lab work drawn. If you are able to be present during the procedure, there are several things you can do to help provide comfort to your baby. One of the simplest ways is by offering them a pacifier. Sucking on a pacifier can help soothe and calm your baby and can be helpful during medical procedures. You can also talk to your baby in a calm, reassuring voice. Your baby may not understand the words you are saying, but the tone of your voice can be comforting and reassuring to them. Let them know that you are there for them and they're not alone. As previously discussed, holding your baby in a containment hold can also provide comfort during a time of stress or medical procedures. The pressure and warmth of your body can be soothing and reassuring to your baby. It's important to note not all medical procedures allow parents to be present at the bedside. In these instances, it's important to trust that the medical staff is doing everything they can do to help your baby feel safe and comfortable. Milestones. When you have a baby in the NICU, every milestone is a cause for celebration. From the first time you held them, to their first bath, to their first bottle, there are many important moments to mark and cherish along the way. As your baby progresses in their care, you may also celebrate more significant milestones, such as the removal of their feeding tube or their breathing tube. Each of these milestones represents a significant step forward for your baby and brings you one step closer to going home together. It's important to take the time to celebrate these moments, no matter how big or small they may seem. Celebrating milestones can help you feel more connected to your baby and can also help you stay positive and focused during what can be a stressful and challenging time. There are many ways to celebrate milestones, from taking photos and videos, journaling about your experience, placing small milestone cards on their bed in the NICU, to simply taking a moment to reflect and feel grateful for the progress your baby has made. You may also choose to celebrate with family and friends or with the staff at the hospital who have been caring for your baby. No matter how you choose to celebrate, the important thing is that you take the time to acknowledge and honor the progress your baby has made. By doing so, you can help create positive memories during what can be a difficult time. As we wrap up this lesson, I want to remind you of some important points to keep in mind when caring for your little one. Firstly, remember that infants in the NICU have a routine that is designed to be easy for you to follow. It's important to be there for your baby to participate in their care when you can. Don't be afraid to jump in and assist with temperature taking and diaper changes, as this is a great way to actively be involved in your baby's care. There are several ways to hold your baby in the NICU, and it's important to find what works best for both you and your little one to promote the best bonding. Providing comfort for your baby in the NICU is a crucial way to reduce stress and discomfort, which can ultimately lead to a stronger bond between you and your baby. Lastly, it's important to celebrate your baby's accomplishments, whether they are big or small. Every milestone your baby achieves, no matter how small it may seem, is a significant step in their journey. These accomplishments will be memories that you will cherish for a lifetime to come. So stay positive and focus on the progress your baby is making and be proud of every milestone they achieve. Remember, being a parent that is involved in your baby's care in the NICU is essential to building a stronger bond with your little one, and celebrating their achievements along the way will make the journey all the more meaningful.